Okay, in this video, I wanted to go over marijuana and cancer, and specifically head and neck cancer, since that's the field that I work in, and basically CBD, ATHC, marijuana. I think this topic has three areas. One is what is the relationship of marijuana and the cannabinols, uh, cannabinoids, and the pathogenesis of cancer and the treatment of cancer. And part two is kind of, can we use these cannabinoids to treat the side effects of cancer, or the side effects of cancer treatment? So kind of as a complementary treatment. All right, so let's look at first thing. Does marijuana have any relationship to the formation of cancer? So there's two studies that I found. One is this smaller study out of McMaster University in Ontario, Canada. And basically in this paper, they look at their own data from their hospital and look at patients that were marijuana users at least on a weekly basis. And then compared to non-users, they found out that basically marijuana users were more likely to have oropharyngeal carcinoma. P16 positive oropharyngeal carcinoma. This is a type of head and neck cancer that's very common nowadays. It's not primarily associated with smoking and drinking like other head and neck cancers, and is associated with the human papillomavirus. So the marijuana users seem to have a higher rate of this. Now, there is a lot of confounding factors because higher rates of P16 oropharyngeal carcinoma is also associated with higher rates of oral sex. And so the marijuana use and that may be correlated, so that may be a confounding factor. So there is a larger study called the Enhanced Consortium, where a bunch of different groups across the country and across the world looked at the association of marijuana smoking with oropharyngeal and oral tongue cancers. And they looked at that association and tried to parse that out. And basically, at the end of that thing, it's very interesting, they found out that indeed there does seem to be an increased risk with oropharyngeal carcinoma, P16 oropharyngeal carcinoma. Let me look at if in the abstract they tell you. So it's an odds ratio of 1.24, so 24% more likely to get oropharyngeal carcinoma. But surprisingly, they had a reduced risk of oral tongue cancer. So that odds ratio was 0.47, so almost a 50% reduction in the risk of oropharyngeal carcinoma. So it seems the best data we have right now seems to indicate that marijuana use increases your rates of oropharyngeal carcinoma and may decrease the rate of oral tongue cancer compared to non-users. Okay, and then part two, do these compounds actually work as a treatment for cancer? So this is a paper out of South Korea, published in 2020, and basically they're looking at cannabidiol, and this is abbreviated CBD. So this is like what you see in CBD oil. So there's two major cannabinoids in marijuana. There's cannabidiol and tetrahydrocannabinol. So THC, that's the one that has the psychogenic effects, and people get high from that. CBD is not supposed to give you the psychogenic effects. At least not the high part. There is some cross-contamination when they make the formulations, because it's hard to extract one without the other. But anyway, in this case, they're testing CBD, and what they did is they tested it in vitro, so that means in cell culture. They as you increase CBD oil, then the viability of these cancer cells goes down. And then they tested it in animals. These are xenograft models, so these are not immunocompetent models. And this is this just shows that in vivo, in a mouse model, it does seem to decrease the tumor growth as well. And then when you check it along with commonly used chemotherapy agents such as cisplatin, 5-fluorouracil, and paclitaxel, when you add the CBD, you can see that there's a reduction in the cell viability. So the black bars are just the chemotherapy agent, and then the gray and the lighter gray bars are higher concentrations of CBD oil. So this study indicates that CBD does seem to, at least in vitro and in vivo, so they have not done this in people, this is in the lab, it does seem to decrease the viability and the efficiency of chemotherapy agents in treating head and neck cancer cell lines. So this may or may not correlate with actual tumors in people, but it is promising. And then this is a paper out of UC San Diego where they look at cannabinoids, and in their case, they're looking at THC, not CBD. So they're looking at tetrahydrocannabinol. And what they found out is that it in vitro, it causes increased progression. So it seems like the CBD may be helpful, but the THC may be pro-cancer forming. And so this group is now repeating the same study, I believe, with CBD. And so I'm kind of anxious to see what that shows. But it looks like from this paper out of the group in Korea that CBD seems helpful, and this paper out of the group in San Diego that THC is not helpful. All right, so the last part of this whole thing is a lot of people use marijuana and CBD to help with some of the side effects of cancer treatment. And one of the big problems in cancer treatment is that there's a significant amount of psychosocial distress amongst head and neck cancer patients. So in this study, based out of UC San Diego, they found that there was like almost half the patients with head and neck cancer before they started radiation treatment were having at least mild depression, so mild to severe depression. That means half the people have some level of depression. That is a significant number, and that number only goes up during treatment. And then in this one, they did a longitudinal study, and they found that, and they're using, I think, the clinical definition of depression, which is a kind of a higher bar, but this is 15% are depressed by clinical criteria, and that rises to 30%. So that is a significant portion of patients that are clinically depressed. And then fatigue also is a huge problem, and they noticed that fatigue increases and maxes out at 6 weeks during so towards the end of radiation treatment. So fatigue, depression, anxiety, these are all things that are very common in the head and neck cancer population, and we are probably under treating them. And there's many factors that make treating these things more difficult. A lot of the head and neck cancer patients come from low socioeconomic backgrounds. They don't have a lot of resources. They don't have a lot of family support, many of them. And so this makes dealing with psychosocial distress even harder. But there are some papers that indicate that people are using medical marijuana to help with these symptoms. So this is a paper out of, again, McMaster University. And what they did is they found 74 patients with newly diagnosed head and neck cancers who were marijuana users. And then they found 74 that were very similar in every other aspect, like age and diagnosis and stage, but they don't use marijuana. And they compared them on looking at depression, anxiety, pain, appetite, general feelings of well-being based on a survey. And they basically found out that the marijuana users had less pain, were less tired, less depressed, less anxious, had more appetite, less drowsy, and felt generally better, according to their own self-report. While this is a interesting study, I mean, there's a lot of problems with it, which they mention at the end. Basically, you know, it was self-selected, so the people that self-select to use marijuana may just have lower rates of those problems to begin with. So, you know, they may not be comparable. So someone needs to run kind of probably a randomized control study on this to see if it actually helps. But there seems to be some data to say that it may be helpful. Let's see here. I think I found another Yeah, so this is another one, medical marijuana use. This one, they just looked at 15 patients that used medical marijuana, and they just sent them a survey. They all replied, and they said they thought it helped them. This has no control group. This is an even weaker study than the other study. But again, this demonstrates that maybe there is some benefit to medical marijuana in these people in the treatment of depression, pain, anxiety, appetite, things like that. Okay, so last thing to consider about medical marijuana and these cannabinoids is that one of the biggest problems that head and neck cancer patients have is xerostomia, and we know that cannabinoids decrease saliva secretion, so it may make xerostomia worse. And also, cannabinoids are known to have effects on liver function, so it does hurt your liver a little bit. So it's not a zero risk proposition, but I think it's a lot of interesting work to be done. If there is significant anti-cancer properties of CBD, as this paper out of Korea suggests, and if CBD can be helpful to help with some of the other side effects of depression, anxiety, pain, and appetite, then it should be it's worth looking into, and I think that someone should run a trial where it's not self-selected, and we can look into those things. But promising, and I foresee with the increased use of CBD and marijuana legalization across the country that studies like this are going to be forthcoming soon.